The way our country is not caused by doctors. Nigeria cannot be in a mess and you expect the healthcare sector to be needed. It cannot work. One, the electricity that needs to be supplied will not be supplied by doctors. Water supply that needs to be supplied will not be supplied by doctors. The medical equipment that are needed and to be provided on time will not be supplied by doctors. CS is not an abnormal disease. I need to emphasize this. Where I work, there are seasons and times whereby the organization work will provide free Cesarean section services for women. We now discover that women that have been hugging with us claiming Hebrew women, they don't want to do sex. By the time they discover they are not going to pay, they willingly give consent. There's no specific number of Cesarean section a woman can have. At least I've done 4, 5, 4. Many women have had 4 CS.
Wow.
Many, some have had 5, and I've operated 6. So I was looking for 7th one. It's a challenge to the house.
The job is kind of dangerous.
That's the truth.
Wow.
Because you see, when you stand in the place of God and you are not God, it's a very delicate position.
It's not curable.
Cerebral palsy is not curable unless God performs a miracle. One of my FA patients that traveled to the States, to the US to deliver, I have counseled her before that will be Cesarean section. She got there and they were telling her, no, you can still try, you can still deliver. They removed the surgery and later they just give her double suffering. You see, labor and in the long run develop preeclampsia, they rush at the theater. I told her, you see, it's not, it's the country that's messing us up. We know what we're doing.
What's the cause of Cesarean section?
Okay, the reasons for this.
The reasons.
Yes. The reasons are many, rather.
Okay.
And for us to understand, I'm going to break it down into reasons for Cesarean section arising from the baby, reasons from Cesarean section arising from the mother, reasons for Cesarean section arising from the placenta, and some arising from both of them, so that people can understand. Let's start from reasons arising from the baby. Because some women are okay, it's their baby. And some baby are blessed. Because some women will be hungry, some men will be hungry that you have delivered 3 babies. It is you, number 4 baby that made me to go undergo the night. And I also want to dispel a common belief among our people. You know, when people are doing traditional wedding ceremony, they will tell you that, let me say it in Yoruba language, it's a very big lie.
Please interpret.
That nobody conducts Cesarean section for the cow and the goat. It's because of ignorance. Veterinary surgeon are doing CS for cow and cattle. If you go to University of Ibadan, my elder brother is veterinary surgeon.
There's this particular doctor on this TV.
You will see them even in Nigeria. They do Cesarean section for cow who are problem. So you see, it's because of limitation of knowledge. That is, say that not be when they are doing ceremony. So if they have not said you're a perfect and wonderfully made woman, let nobody deceive you. Let's go to reason for Cesarean section arising from the baby. The first common reason I would like to mention is big baby. When the baby is too big. Just like when this studio now, there's no way a Dangote trailer can pass through this door. It would bring out the whole building. Sure. Some babies are big that they cannot safely navigate the birth canal of their mother without injuring the mother and and some can even kill both of them. In our Nigerian context, African context, any baby that is 4 kg and above is regarded as big. Medically, we say they are macrosomic. You know, macro means big. Soma body, big body. But the Americans use the word about 4.2 kg and above because their women tend to have bigger clefts. And big baby can be absolute and relative. Absolute is any baby 4 kg and above is absolutely big. Also, a baby that's 3.5 kg can be relatively big for the mother. Some women that are short, they are not so big, their pelvis is now a 3 kg baby might be big for that one now. And that's why generally we see women that are short, and we get to that level too. So the first reason that arises from the baby, big baby. If the baby is big, a lot of time we cancel them for your own safety and for the safety of your baby who are undergoing Cesarean section. But there are some women who have very capacious pelvis who can push out 4 kg baby.
How do you know a woman who has a capacious?
There are instances that, you know, the way we estimate the weight of baby is subjective. We use scan and other things to give us a rough idea. If you look at, for those who are pregnant, if you look at the scan, they will write estimated fetal weight. They won't write absolute. If you say any doctor writing, this is the authentic fetal weight, the person is trying to do over sabi. It's when the baby has actually been born that you now look at the way you get the actual weight. So when we do estimated fetal weight, it gives us an idea of the weight. There are times that when we estimate fetal weight, the weight will be smaller than expected. I've had a woman, maybe while we were using a less advanced count, that the batch weight, estimated weight was 100 kg. And we induced the woman. The baby refused to come until we resorted to cesarean section. The baby, I think, was 4.95 kg. Wow. Thank God she was laboring in the standard hospital. Wow. But the estimate from the scan was 2.9 kg. Wow. So there are times that the estimated fetal weight we have gotten before labor might have underestimated it. And some women, we just luckily they have capacity of pelvis, they've delivered the baby. So from record, it's already recorded that this woman has a very good pelvis to deliver the baby. In those days, there's something we call pelvimetry.
What?
Pelvimetry. Okay. No, metry means measurement.
Okay.
A way of assessing the pelvis of women. So pelvimetry may also give an idea of how capacious, how wide the pelvis of the woman is. But these days, pelvimetry is not something we do routinely for first timers. Because we know that pelvimetry has also made some women to do unnecessary sex. And pelvimetry has also misled some women that because there can be false positive, false negative. So what we do now, if the woman is not so short, at the head of the baby is the best pelvimeter. Pelvimeter is what we use like an instrument for measuring the size of the pelvis. So most first timers, if there are no absolute reason not to let them try, we allow them to try. The head of the baby is the best measurement for the adequacy of the pelvis. So these are some of the ways we can have an idea of how capacious the pelvis of the woman will be. And women that are tall and they are old, it is generally assumed they have capacious pelvis, but some may not be so. So big baby, that's the first reason. Second reason, baby can also be in distress, what we call fetal distress. You know, in labor, we listen to the heartbeat of the baby. How do we know the heartbeat of the baby? The normal range is 130 to 160. You know, in that dot, when you go to the hospital, they measure your pulse. The heartbeat is like the pulse of the baby. For adult, it's 60 to 100. But for babies in the womb, the normal is 120 to 160. That's the normal range. So when it's below 120, that is too low. We call it bradycardia. Cardia means heart. Brady, low. Okay. If it's above 160, that is tachycardia. It's higher than normal. But automatically, it does not mean when you see 165 and the baby is about to die. No, there are other factors will put together. Any fetal heart rate that's less than 100, that is abnormally low. Something must be done. But if it's like 110, it's not yet so critical. 170 is not yet so critical. But we now look at other factors. Normally, baby should never poo-poo in the womb. We know for those of us when babies are born, their poo usually green. We call it medically meconium. That's the medical word for poo of baby. No matter what, a baby should not poo inside. When a baby in labor poo-poos, baby is not comfortable. Something is amiss. So if the heartbeat is not within range of 120 to 160, the baby is poo-pooing inside, it's already showing sign that this baby is normal. Now look at some other things. So when we have fetal, the mother may have even delivered about 3 babies. But this fourth one is having fetal distress. We will not say because she's a pro, the provider that delivered big baby. This one is dying. Fetal distress means a dying baby. We have to go in, bring out the baby. Are we together? Second reason,
Yes.
baby, big baby. First reason, big baby. Second one, dying baby, fetal distress. The third reason is that some baby like playing gymnastics in their mother's home. There's somersault. They won't be the normal position. No, the normal position for baby is the head must be coming down. What we call cephalic. The one we do scan, you like cephalic. And they must be lying straight. Like we call it longitudinal presentation. Longitudinal lie, cephalic presentation. So any baby that is not coming with the head is not in a proper position. There are more than so baby will see that's breech. Okay. And some may be coming with their feet, footling breech. That we call footling breech. And some baby will just lie across. What we call transfers. Even if the mother delivers 7 babies, all normal, and this one is not lying across the transfers, or is sitting down, that's abnormal fetal lie, abnormal fetal presentation. That woman will do cesarean section, not because of herself, but because baby are doing gymnastics inside. Because a baby that's lying across, how will she come up? In those days, babies are lying in breech, that is sitting there. We used to allow them to deliver normally. Some, not all. And so can breech delivery.
How does that happen?
No, normal labor starts with monitor. That's when we conduct it. There's a way to see come, especially babies that fold their leg. No, some will come with the leg. Some will see sitting down, but they will fold their leg up. Such one even easier. But this the early breach with contour cesarean section for them. For two reasons, it is better, it is assumed to be safer, and also for litigations. The rate of cesarean section is also rising because people are not giving doctors and medical a benefit of that again. Any small thing, they go on the internet. They will start quoting for you. In the US and the UK, a standard practice that once it is breached, it must be cesarean section. And that's why I don't want anybody to drag my name. There are some practices in the 70s, in the 80s that are still good medical practice. In this fact that we can still allow the woman to try breach, but this day, no gynecology will consent to that. But you don't know the one that will go down south, that will have complications. That was the case of a doctor, I think the UK, I read online then. He decided to give the woman a trial, breech delivery. And in the process, something went wrong. The baby developed some pulse, injury to the nerve of the. And then they sued the doctor, they sued the hospital. You know what the lawyer was quoting them? If I read it, I can still remember, I might not be quoting for verbatim, that these doctors still belong to a minority of specialists who still believe in normal delivery of breech. Most of his colleagues will have done a cesarean section. You see, the doctor was looking straight.
He has destroyed his career.
So we not say don't make yourself a sacrificial lamb. Some of the practices that are there. So at the part of the reason party, that cesarean section is also increasing. Like in counseling some of my patients, I will tell them, well, the reason that you have to do CS now is relative. Relative means that it's not absolute that you cannot deliver normally. But in the setting I'm practicing, this gadget is not there, this there is not there. So if you want to deliver, if you say Dr. Lamo is my doctor, I want to stay with it, it will be a cesarean section. Or if you want to try normal delivery, I can refer you to bigger hospitals. My patient will be interviewed where they can give you this option. My counseling for CS is not that I'm not aware that you can still try normal delivery. But in this setting that this gadget is not available, this is not there, it is not so safe. If you want to stay here, to be a CS. If you want to try normal delivery, we are still good friends. I will refer you to those facility. So there are some relatives.
You're not going to take responsibility for that.
Yes. So so that you can try and not be made. It won't make you a scapegoat if things go down south. So I always come out clean and open to patient. So third reason is baby not lying normally or staying normally. Breeze, transfers, and some of these, it's not the woman, the mothers cannot help it. A baby who decide I want to be with some boat here, I will turn upside down. It's nothing the mother will be able to do to that. So, and these are some of the reasons for
What about, I've heard of, a baby getting wrapped by the umbilical cord. I don't know.
Yes, we can talk about that. That one we can partly also group it under baby or reasons having to do with placenta cord. Now, it's not all babies that are wrapped cord around their neck that has to be delivered by cesarean section. Not all. One, if some baby wrap the cord around their neck once, and if it is loose, if a lot of people after they have been that's when we say, this baby has cord around the neck, we quickly separate it. A lot of people have been born with cord around their neck or their body or their leg without issues. But some can cause issue. One, if they wrap the cord around their neck multiple times. And there's one of my patients on a Saturday where I was even planning to rest and enjoy myself. She just called me, good Dr. Labo. My baby is not kicking well. She was not yet down around 35 hours. I told her, well, you just meet me in the hospital. I thank God she was one of those that was very obedient. And the way she has some other medical challenges. Just told her it is time, let's go and bring out this baby. When we got into the theater, the baby wrapped the cord around and about 4 to 5 times. That baby was ready to commit suicide. Because that one was too much tightly. And thank God we intervened. Such a baby could have died. Because it was multiple times and they were not so loose. So cord around the neck can also cause issues if it is tight or multiple times. But a lot of baby, one loose cord around the neck or around the body, they skate through without issues. Now let's move to reasons arising from the mother that can lead to cesarean section. The first on the list I would like to mention is maternal request. Women requesting themselves. And this day, Brazil has the highest rate of cesarean section in the world. Brazil, almost up to 50% in normal. There are women, they don't stress themselves.
They don't want to go through the
They just of going for CS just to get the baby. Have very high rate of cesarean section. I think they have their ears, even though contact has beaten them so far. So, and we are beginning to see more and more of that here too. Women will request for what reason. Our the parents that walk into our antenatal client actually told us I'm going opting for cesarean section when it is time. What was her reason? She witnessed how her elder sister had very bad tear after normal delivery. Those of normal delivery too, they'll be more traumatic than CS. Had bad tear, another I said, I don't want to go through this kind of mess. Book me for cesarean section, and everybody comes out through and we're all fine. And that's what she did. So maternal request be a very strong reason why people opt for cesarean section. Secondly, some women have medical conditions that will make us to advise people who says, I mentioned some of them like complications arising from blood pressure in pregnancy, preeclampsia and eclampsia. Some people who have very severe. When women develop preeclampsia, I mentioned earlier, IBP with protein in urine. In a woman that is more than 5 months pregnant, that's preeclampsia. There are categories where mild and severe. If it is very severe, and there is no prospect that the woman will deliver soon. When the severe BP very high, more than 160/110, she's having a headache, she's having abdominal pain, she cannot make urine wet, that BP has to come out on time. Or the woman has started convulsing. When the BP is very high, there's protein and urine, she's convulsing. Because the care for that thing forces to deliver the baby at the placenta. Until the placenta come out, the condition will not begin to revert itself. So we have to first deliver the baby. And most times it's very severe. And the delivery is not imminent, meaning that maybe the next few hours, the woman will go to bed. It's cesarean section. No, that one is not actually from the baby. No, it's from the mother. Though the baby also has a role in causing it from the beginning. But in that instance, it has to do with the mother. Third reason that may be the reason why more women undergo it, those who have a very bad pregnancy history, we call it bad obstetrics. Some women have had repeated preterm delivery, the baby not surviving. Some have repeated miscarriages. Like one of my earliest patients in camp, I think that it was her 10th or 12th pregnancy that she came to. She left all the way from Ondo State to camp.
10th.
10th or 12th. She has lost so many pregnancies. And she came. She was among my earliest patients when I came to camp there. And to God with this object, she carried the pregnancy to 9 months. And I told her, you are not a candidate to say you will be pushed. It's your history. We have lost. That's bad pregnancies. So was initially still dragging. People will tell you are problematic. But at the point in time, her BP started going up too. She had to succumb and surrender to this section. And thank God, she had the baby. She went home with her baby. So that was a classical example of a woman that had bad pregnancies. The reason being that it's not that some of them were allowed them to try to get deliver, but in your minute, those are what we call those precious babies. Those are not the ones who want to go through the rigor, the stress of 10, 12 hours of labor with uncertainty. Go to the theater, bring out the baby. They will everybody be happy for the glory of God and benefit of Mark. That's our politician commission projects. So, and under this history too, women who have undergone what you call assisted reproductive technology, IVF, will go for IVF. In our client, in some other country, they may have other practices. Because that's also a precious baby. Once you go for IVF, we always cancel them a bit more. It is a cesarean section. We don't want to go through the rigor. We are spending millions.
Is that like a standard practice?
The standard practice is a digestive practice. It's a standard practice because you see, some kind of people are likely to make monthly or even go wrong. And there are times that some things could be unpredictable, even labor. In the best of centers, there are times that a woman might be going, everything appears smooth going. Something like, just like the way adults have sudden death. Babies too can have sudden death, unexplained. But unfortunately, when such things happen, people don't want to listen to any reason. They crucify the doctor. There have been instances, even in developed countries, that they have unexplained fetal death. It happens. So like an adult can just be walking around and collapse. Babies have been born with congenital heart problem, and it starts from where they're the moon. Recently, one of my baby came to antenatal. If she had not come that day, the baby could have died. The midwife just discovered that the heartbeat was extremely low. They could not, just very low. With this scan, we did everything. We have to rush to the theater to bring her the baby. Another baby it was confirmed the baby had congenital problem.
Wow.
And the baby has even undergone surgery for that congenital problem. If that woman had gone through labor, the baby could die suddenly before we could do anything. But if such happened, everybody would be up in arms to fight the doctors, to fight everybody that were negligent.
So your job is kind of dangerous.
That's the truth.
Wow.
Because you see, when you stand in the place of God and you are not God, it's a very delicate position. You know, it is God that can predict this person will die in the next 1 second. This person. There have been instances that patients are very okay in the world, we have done what we could, and within our things go and they die. But that not all hospital deaths are negligence. There are instances that death occur suddenly, not even given, and it happened in the
Beyond
middle of
anyone's control.
without anyone control. But people will always sue. They will not listen to any explanation. So when things like this happen, when I have a pregnancy, we tell the woman you are not a candidate to start going through all the rigors of 12 hours of labor or certain. Let's round that you.
Oh, that's true.
But I'm aware in some country, like one of my every patient that traveled to the States, to the US to deliver, I have counseled her before good that will be cesarean section. She got there and they were telling her, no, you can still try, you can still deliver. They removed the surgery and later they just give her double suffering. You see, labor and the long run develop preeclampsia, they rush her to theater. I told her, you see, it's not, it's the country that's messing us up. We know what we're doing. She's bitter about how the manager in the US, because they made us over. She was telling them that my gynecology have told me, but they didn't listen. She still ended up with CS as an emergency cases. Wow. So these are some of the reasons, maternal reasons from the mother why CS can be done. Now let me now talk about reasons are involving both the mother and the baby. A typical example is what we call some women will enter, like I said earlier, that we might have estimated the weight of the baby. And we don't know that the baby is actually bigger than estimated. So when labor progresses, that baby, they may get stuck, just like a 5 kg baby trying to pass through. So if they get stuck, the issue is both ways, mother and baby. The baby is bigger than the passage of the mother. And there are two categories. There is one we call CPD, don't mind the big medical ground, Cephalopelvic Disproportion. And I'll break it up. Means head. Pelvic, the pelvis, the head of the baby. No, what I'm saying is both mother and baby. Cephalopelvic Disproportion. Disproportion is an English word. That's a disproportion between two things. They are not equal. There's a mismatch.
The square peg in the round hole.
Exactly. So in such instance, we have allowed the woman to try labor, but there's a cephalopelvic disproportion. There's a mismatch between head of the baby, which is cephalopelvic, and the pelvis of the mother. So they are in labor. I just discovered that the baby is too big for the pelvis. Or at times, some babies are wonder. There's a particular position that the baby should be coming by bending, flexing, bending the head. Or some baby will decide to be stargazer. They will look up. If you raise your head and do your line like this, it's not the same thing. For those who are mathematicians, the diameter will not be the same. Such kind of scenario can cause cephalopelvic disproportion, and that affects both the mother and the baby. So when we quickly diagnose that, it rush the woman to the theater. But in instances and places where that is neglected, if it is not discovered on time, it now become a frank obstructed labor. And obstructed labor can cause a lot of other complications. Is this CPD, or because it was not diagnosed on time, or at time we diagnose it on time, some patient will say, no, I'm an Hebrew woman. And
So the head of the baby comes out and the body cannot follow.
no, it's most times what will come out, but it will start pressing. The pelvis is comprised of bone and soft tissues. It will start pressing on the bladder, start pressing on the rectum where feces is coming, and that's why people have fistula. We have heard of a lot of women with vaginal fistula, and they can also have rectovaginal fistula, feces coming through the vagina, or urine leaking. It's commoner in the north because
the vagina and where feces are coming are not far from each other.
yeah, even where baby come out from, if you look at it, where the baby come out from the vagina is in the center. The bladder is up above it. The anus and the rectum is below. So the baby is actually passing between those two organs of the body. Now,
I thought PVF
vaginal vesicle fistula. That's the correct thing. Vesicle vaginal fistula. Vesicle means bladder.
Okay, I felt it was as a result of maybe having a delivery early, as maybe as a young girl, a teenager, whose reproductive system isn't really fully formed.
Yes, it's because it's commoner in young ladies, but there are adults who have it too. There's even a woman that is recently,
Renal incontinence.
yes, continuous urinary incontinence to continue to flow. For as long as urine is entering the bladder, because there's a hope to continue to flow. The reason why it's commoner in teenagers, girls who are not human, is because their pelvis is still developing. And the baby most of the time will be bigger than the pelvis. And it's everywhere in the country, was coming out not because of teenage marriage. So, and a lot of times, such setting, they will still want them to have normal delivery. So they will keep laboring, the time baby will be dead, they push, and by the time the head is pressing the bladder and the rectum will be open, let's say this is the head of the baby, the bladder is here. All our body, apart from bone, are soft tissues. They are sustained by blood. As it's pressing them, it will compromise supply of blood to those organs. They will start to die. They will start to slow up. What usually happens, the organ will die gradually, and over time the tissue there will slough off, creating a hole. Urine will just be leaking continuously. So cephalopelvic disproportion obstructed labor is an indicator involving both the mother and child baby. Now, other reasons that involve placenta. Some women bleed in pregnancy. Shall call what we refer to as antepartum. It's a whole lecture, reasons for and that's when
I feel like a gynecologist right now. I can go ahead and start consulting.
That's why you see the Bible says, "My people perish for lack of knowledge." When people say this was just operating for no reason, there are many reasons for sex.
Okay, on that note,
I think we cannot exhaust the reasons for
There are so many reasons. There are other ones I will meet, but I want to quickly mention these two reasons before we leave that. The reason that have to do with placenta, because it's relatively common too. You will see pregnant women bleeding in pregnancy, bleeding heavily. There are times the placenta should not precede the baby. The placenta should not come before the baby. It should be up by the side or above. But in this sense, where the placenta is coming before the baby, coming at the lower part of the womb, at the cervix, we call it placenta previa. It usually is the commoner, or let's say the commonest causes of bleeding in pregnancy. And most time when it's very severe, most of them will deliver by cesarean section. Because they want to insist, they may bleed seriously to death. Or cause a lot. Usually placenta previa will affect the mother before it affects the baby. It will eventually affect both of them. The second common reason is the one that the placenta separate before baby is born. We call it placenta abruption. Medically, we say placenta abruption. But abruption means forceful separation of its own. So when the placenta separates from the womb before the baby is born, ideally placenta should not separate until the baby is born. So when that happens, the woman will start bleeding. And most of the bleeding affects the baby because from the placenta. A lot of time the baby will be there before the people do something else. But if the baby is still alive, we quickly rush to the theater to bring down the baby. So these are some of the common reasons around why cesarean section is done. So it would be good to educate our people that Dr. Jones will wake up. No reasonable doctor will wake up from that today all pregnant women is yes.
Okay, wow.
Knowledge.
Yes.
Thank you. So, what advice would you have for people who would always be like, I'm an Hebrew woman, I have to deliver this Hebrew way, I don't want to go for CS. What advice would you give them? What advice?
Okay. I want to start by saying that because I'm a Hebrew man. Hebrew man resident in Nigeria. I want to say that most of us, including doctors, naturally will not want to do CS. Even those female doctors or those who have it's a natural feeling. But that comes to a time we should allow knowledge, and medical realities, facts, and correct diagnosis to of our religiosity or so-called prophecies. That comes a time we need to allow sound medical knowledge, our good educational exposure to override this for the sake of the mother and the baby. And I'm going to cite an example where I was working before, for us to know that Even at times religion overrides reason medical. This happened to a medical doctor who happened to marry a second wife. And a cleric from the other religion told him that he should not allow his wife to be seen by any other male. The man is a doctor. He has a private hospital. I know I used to consult for his hospital before. And truly the wife got pregnant, asked for a God, and he refused to go and consult in the hospital. I could have even attended his wife free of charge. But he kept the wife in the house. You know, the wife get pregnant, labored at home. They lost the baby. This person is a medical doctor, not a lawyer. Because a cleric told him that it's not a good thing to allow, and he believed. But when the wife became pregnant again, nobody told him. He called me to come and help see his wife. So I'm saying that these of us, as I transcend educational and medical knowledge at time. But we need to realize that the ultimate objective of every pregnancy is to result in life delivery of both mother and baby in good health. A woman can achieve normal delivery and she's not in good health. A woman can achieve normal delivery and the baby will have cerebral palsy. And the baby will become, I've seen among my patient reviews before, that baby will have worthy adults. Yes. There was even a lady, in one of the hospitals I consult for, very short stature. Part of the reason for say why I forgot to mention is that when a woman has inadequate pelvis, there's a relationship between the height of a woman and the adequacy of her pelvis. Medically speaking, we know when women are less than 1.52 meters and below. 1.5 meters. Some people like to put it in feet, but I like meters. Okay. 1.52 meters and below. Generally speaking, not there will be a few exceptions. Some lady may be short, but they have wide pelvis.
But not knowing why they take measurements when you're pregnant.
Majority of them who are 1.5 meters and below, we regard them as short. Majority of them will have inadequate pelvis. And most of the women who had that cancer, only few who refused escaped. Most of them ended up with over 98-99%. And some did not have good outcomes. Some lost their babies. Some have babies that have cerebral palsy. Because when you subject, like I said earlier, the baby to prolonged labor, oxygen supply to the brain will be compromised. Even if the baby is born, you force the baby out, it might end up a vegetable with cerebral palsy. So it is important that we know the ultimate objective of pregnancy to have a good outcome. Life at the healthy mother way, safe delivery. And this cannot be achieved all the time with normal delivery. There are many times that the only way to achieve this objective to a Cesarean section. And the reason why our Hebrew sisters, and I belong to Hebrew brotherhood, in this content, but we are Nigerian, we need to realize there is no joy in giving birth to a baby that is a vegetable. Like the example I was trying to cite, where one of the students I consult for, I even offered my services free. And this lady, there's no even going through. They are evil too now. And both babies have cerebral palsy. When I look at their height, short, say, you know, I won't be you because we work in this place. And I will use my own fuel to transport myself away to come to the hospital. But some people rally around there, including some health workers, don't listen to Dr. Lawo. They labor. I also call at the point, it is no, stop this process. She ended up with doing the Cesarean section. The baby has cerebral palsy now. They spend money with pediatrician. The baby is a vegetable. So the ultimate objective,
It's not curable.
cerebral palsy is not curable unless God performs a miracle. And the baby will not achieve developmental milestone at time, not be able to sit when expected, stand, baby will not be able to do well in school. It's a kind of lifelong source of sorrow to the parents. And the common reason, there are other causes, prolonged labor. And most of the time, such people refuse sex. So we need to come to this and that the ultimate objective of pregnancy and labor is to have life and quality mother and baby. Baby may be live, but not be of good quality. Like this one, the baby, these instances are cited. Babies are alive, but they're not of good quality. And there are instances that the mother will also be alive, the mother will no longer be of good quality. A woman came with very big baby. We have assessed both through scan, clinically, medical, like this baby is big. Don't try to push the baby yourself. She went ahead and away from what they pushed out the baby, and now she started limping after looking for physiotherapist. You know, some people, there's something we call foot drop. Foot drop, okay. When it can happen during labor. When a woman has been subjected to labor for long, or the baby pressing on some nerves, you know our muscles are working when we call the electric wires in our body. We call them nerves that transmits electrical impulses to all our muscles to work well for us to carry our body well. Some of the nerves can be injured in the process of labor. So she's not limping. Some can have injuries to their pelvic joints and looking for physiotherapy. They later give me a mirror that she was in pain. All for what? I want to be an Hebrew woman. I didn't have the opportunity of assessing whether the baby is also of good quality. That was not a woman with good quality. Some women will push out the baby and they will rupture their womb. They will run around to save their life. That's not good quality mother. Some will deliver, baby may even be alive, they will have fistula that I mentioned. Leaking urine. There was one woman recently I have to refer to the teaching hospital at Elisha, where they do 3 surgeries. It was during, she delayed agreeing for CS. She did this CS and started having fistula. They just repair it for her, the Wesley did also. So we need to realize that it's not just to deliver, it's to deliver and be in good quality state of health and mind, both for mother and the baby. And for the father too. Vaginal delivery is still the better of the two when it is safe. It's safe. It is safe.
I remember my first child. I had my water broke like in the night around 9 p.m. But because my husband's sister is a medical doctor, so we called her. She was like, we should not panic. Every of the scan is said to her, so she follows up very well. So we went to the hospital in the morning, and I was there. I was in contracting. So it was until they gave me this small pill and so, but then I have had another issue of a friend that her water got broken at somewhere around, and the doctor said because the water got broken by itself, it has to be a Caesarean section.
Well, that statement is not absolute. It may be possible. At times, when water breaks, the content or the water surrounding the baby might be fully exhausted. I know that water provides a kind of cushion against compression of the cord. And if labor has not gone far, maybe the water just break and you are not even labor at all, and there's no water again. That's why we say we take it case by case. The doctor might advise cesarean section. But if water breaks, the woman is already in labor, the head is almost coming out, the woman over is cesarean section. And there are times that when water breaks, the cord will follow. And when cord follow before the baby, that's an emergency, like I mentioned earlier. So there may be some other fine detail that you find in most of that so that's why I say you can't be a doctor in 1 hour.
Yeah. So I feel people should stop comparing these two.
Exactly.
Because the same thing happened to me, happened to her, but it was of different results at the end of the day.
Wow.
Yeah. The water got broken at night, and I was peeing on my body. I was calling her Monto Sarah. She said, "You're not peeing, it's your water, don't worry. You're not peeing."
That's why I didn't want more than 2 breaks.
Domestic gummo.
No, sir. The break, I don't have the
mental
feelings so big that because when I'm pregnant too, 9 months, that won't want to do it out. And that's my things are there. If you don't get to already, then it's such a. So with these few points or Dr. Allow more, I can confidently say that having a cesarean section
It's not a
disease.
it's not a disease. It's
not
a big deal. I sincerely haven't listened to all I've listened to. I can say that my dialysis are beginning to, go into, the shadows. And want to say a big, big thank you for coming again and being a blessing to us and sharing a knowledge. You mentioned something which was we require knowledge to succeed, as the Bible said, that my people are destroyed for lack of knowledge. So with proper knowledge, then people can, know better and do better. So I want to say a big thank you for being a part of this program again. And so my colleague, my family member, thanks. Yes, a few words.
Okay, it's been a wonderful section with Dr. Laumon. One would want to get pregnant today and have him monitor the pregnancy from A to C. Everything seems to be very easy the way he was saying, and I feel it's easy as well. So I would just advise women that when you're pregnant, try as much as possible to go to a very good facility, to use a very good facility. And also, I think people or most women don't really take antenatal care as important. Yeah, because if you take it so serious, all these things would have been something that would have been ruled out, would have been seen. Maybe you want to go for a cesarean section, or you want to have it the natural way. Let's put it that way. And I want to say again that people should stop asking when you say, as somebody put to bed, they will say, is it the normal delivery or the cesarean section? Dr. Olamo has been able to tell us that cesarean section is not abnormal. It is also a normal way of delivery. So I would just advise everybody to please, when you know you're pregnant, the women, when you know you're pregnant, try as much as possible to take the antenatal care. Important. Thank you so much for staying tuned with us.
Yeah, thank you so much. It's been an awesome time. And remember to subscribe to our YouTube channel on Dr. Shino Aladejuvelo TV so you can, watch our previous episodes and also the episodes for season 3. Remember, it's Health is Wealth season 3. Yes, do have a wonderful time. But before we call it a day, I'd like to say, happy people!
Happy family!
God bless you. Have a wonderful